Good afternoon, ladies and gentlemen. Can I ask you a question? Who thinks we had a nutritious lunch today? Hey, great. I am pleased to facilitate the next panel on nutrition and health outcomes. I have been involved in the Canadian International Food Security Research Program during the past 8 years, and very happy to see here researchers and team members from many of the projects I had the privilege of being associated with. So good to see you all, and many interesting partners and guests being here. Yeah? More? Okay. This is better? Thanks. Yes. We know that nutrition is central to the 2030 Agenda of Sustainable Development Goals. And we are also learning that there is a slowing trend in the rates of reduction in undernutrition. This is happening in spite of improved food production. And this trend reiterates the complex interplay of multiple food and non-food factors that are affecting the person's nutritional status. It's also now clear from research and evidence that food insecurity not only contributes to undernutrition, but also to overweight and obesity, both forms of malnutrition coexisting in many communities. The CIFSRF, as we call, from the beginning, supported nutrition-based innovations alongside the efforts to sustainably enhance food production by smallholder farmers, with special emphasis on smallholder women farmers. With the recognition that women and girls and young children are the majority of the world's undernourished, there is an emphasis which was rightly placed by the program to understand the factors that can improve the diet quality and nutrition for this group of population. As you will see in the synthesis document which we have been talking about, to some degree, all projects within CIFSRF considered nutrition, while 56% focused more explicitly on nutrition interventions, aiming towards improving diet quality, while they're testing complex programs about scaling up broader food security interventions. So we call these, as you know, nutrition-sensitive interventions, with a complement of nutrition-specific where necessary. And most projects have used a combination of strategies. 3 of them come out more specifically while they're considering nutritional outcomes. These include dietary diversity and more nutritious crops, value-added food processing and food fortification, and nutrition education and promotion. Recognizing that improved nutritional outcomes not only occur as a result of better diet quality, but they're also influenced by water quality, care practices, disease burden, and sanitation and health services. That's why nutrition education was a common factor across all these projects. And projects worked for greater inclusion of women at all stages of the production and value chains, and to improve their decision-making within households. This also came up during the first panel discussion. So objectives for this afternoon's session on nutrition and health outcomes is to highlight research findings and development outcomes from a sample of nutrition-sensitive projects supported through the CIFSRF program. And we're also hoping to identify lessons and applications that make it easier for women and girls and young children to consume nutritious foods and healthy diets. There are a number of projects, as I mentioned. We cannot do all of them, but during this panel, we'll hear from 3 projects. I'll suggest mention their names of the presenters and the main institutions involved, recognizing that there are many more partners and institutions who have been working together as part of this. After the first 3 project presenters, we'll have 2 external panelists similar to the morning session who would give their reaction to the presentations and also their perspective connecting to their broader experiences, so how we can relate to them. Now, the three presenters are from Colombia, Nutritious Potatoes, Dr. Teresa Masquera. She is the principal investigator for that project. And after that, Dr. V. Nguyen Do from the National Institute of Nutrition, Vietnam, followed by Dr. Sue Horton from the University of Waterloo for the Tanzania vitamin A fortification of crude sunflower oil. So I would like to invite Teresa to the podium. Thank you.
¿Cómo funciona esto? Good afternoon, everybody. I come from Colombia, and did you know that Colombia suffers more than 50 years of armed conflict? And this conflict affects especially the rural areas in my country. And one of the most affected areas was Nariño, that you can see in the map in red. And we decide to work with those communities because they are highly vulnerable. And the main food product is potato. Potato is the main product and also is basic for the economy of those communities. So we think if we can improve the nutritional properties of potato, we can impact to the nutritional situation of the population. Because there are several challenges in Colombia related with nutrition, like you can see in the picture, especially deficiencies in micronutrients like iron, zinc, and vitamin A. We call it hidden hunger. And the food insecurity in Colombia is reaching 54% of the population. But if we see this situation in Nariño, where we work, is serious, is more serious. Like the average in the communities is 90% of the food insecurity for the households. So, in order to alleviate this situation, we develop an innovation that we call it, in general, more nutritious yellow potatoes. They are the potatoes. These potatoes present more iron and more zinc, and also protein, dietary fiber. And currently, these potatoes are reaching 6.5 million of consumers in whole Colombia. So we are very happy with this result. But the potatoes by themselves, they are not the solution. So we implement some social strategies that we call the first one, family farming community schools. These schools link effectively nutrition with agriculture, because these two sectors should work together, and they work separately. Then we try to join in our project. And also we develop a program for education that in food habits and also in gender equity. The other strategy was Chagras for the Life. Chagras is an indigenous name and represents the work with the production for indigenous communities, and this methodology allows us to diversify the diet of the communities that work with us. As one of the important results was that we improved the consumption patterns for the population, and we took the traditional recipes, traditional products, like you can see in this side, but the color is monotonous, and we added new products, new recipes, new practices for cooking, and the colors represent and reflects the diversity of the nutrients. This allows us to improve the dietary diversity score in the household. So the family is more diverse, and it is good for the nutrition. We carried out a clinical study with children under 5, and we measured the biochemical indicators. These indicators show us that the reduction in the prevalence of anemia in the children, and also the reduction in retinol deficiency. Retinol is the vitamin A, and decrease the deficit of ferritin. Ferritin is the protein that stores the iron. So we impact in a crucial elements in nutrition with our project. We learned from our project that it's necessary to have an holistic and comprehensive strategies to face those complex projects like food insecurity. For that, we established the family farming community schools and chagras for the life, and they are available to move them to other regions, I think, on the world. The social innovations are useful to employ them in public policies, to implement programs, and to work with people, and to produce social change. And the sustainability is fundamental to work in interdisciplinary approach. Finally, I want to acknowledge to our sponsors, Global Affairs Canada and International Development Research Center, for making real the many Colombians, for making real the dreams of many Colombians, and for teach us how to work better. And all the stakeholders in my country, and the communities, and all my colleagues in Canada and in Colombia. Thank you for your attention.
Thank you, Teresa, for bringing out the nutritional components of your complex project. Next, I would like to invite Vi from the Vietnam project.
Good afternoon, everyone. I want to show my project result. Our project is cooperation between the National Institute of Nutrition in Vietnam and Ryerson University in Canada. You know that our project is implemented in mountainous area where the malnutrition rate in children is very high, and the diet of the children is very poor in zinc and iron. That's why we develop winning foods products locally produced from the small-scale woman farmer. And we apply the nutrition food system approach to integrate production of fortified winning foods from direct from the crop from the small-scale farmer woman. We integrate with side by side, along with the education activity to improve the winning food practice for the children. You can see here the established of the food, small-scale food processing. And you can see its products produce the ingredient from crop direct from the farmer. And of course, we have along with the nutrition education for improve the child feeding practice for the woman. And the result we have here, we set up 50 nutrition counseling centers and 17 women were training on agriculture practice, and 20,000 rural women is reaching to counseling center, and 2,550 children in kindergarten eating instant Poorest every day. And anemia prevalence is reduced for 45%. And malnutrition is reduced in 3 criteria: is underweight, stunting, and wasting. And we have lesson learned here. It's private and public partnership is a benefit for nutrition intervention. And we need to sustain nutrition education and product promotion. And evidence from result of the project is integrated into Plan of Action for Nutrition for 2020 and Vision of 2030. And collaboration among with the stakeholder includes the Ryerson University is a key for continue improve food and nutrition security in Vietnam. And I take this chance to thank its Global Affairs Canada and Ryerson and IDRC for support for our project. Thank you very much.
Thank you, Wei, for the interesting presentation. I had the chance of visiting this project, and it's in a very remote area. It's difficult to go there, but still, with their hard work and collaboration with the local partners, they were able to achieve really interesting results. Now, Sue Horton from University of Waterloo, please.
So thank you. I'm here presenting on behalf of our partners, Mennonite Economic Development Associates in Canada and Sokoine University of Agriculture, and two of my colleagues are here. Okay, the slides are coming. Okay, so the title of my talk, which you can't yet see, is A Tale of Two Oils. And I have borrowed a little bit from Charles Dickens on that. You maybe remember his book, but I promise my presentation will be shorter. Okay, and in terms of the challenges, we just had a super lunch, but I want you to think back to breakfast. So how many of you had some eggs for breakfast or milk on your cereal? Probably hardly anybody drank carrot juice or ate mangoes because they weren't on the buffet at the hotel. All of those things are good sources of vitamin A. Maybe you had some margarine on your toast or a croissant. Doesn't seem quite as healthy as carrot juice, but nevertheless contains vitamin A because margarine has to be fortified with vitamin A in Canada. So in Tanzania, diets tend to be strong in starchy staples and relatively monotonous. And vitamin A deficiency is a problem. Vitamin A deficiency has adverse effects. In the extreme, it leads to night blindness and to death. And that can occur. But even in subclinical levels in small children, it has adverse effects on their health. It makes them more susceptible to measles and to diarrhea and to other similar infectious diseases. And it also raises the mortality rate from those childhood infections. Okay, so how can we improve on vitamin A status in Tanzania? So let me introduce our two contenders, and I feel like I'm in a boxing ring, and I'm introducing the contestants. So in the regions we were working in Tanzania, some people consumed palm oil, which is imported, grown on plantations in Indonesia and Malaysia, and is processed by large-scale processors who undertake fortification, which has become mandatory. And the other contestant, the underdog, is sunflower oil. It's actually produced locally, but it's milled by small and medium-scale millers. And it's more healthy because it's less saturated fat. So the challenges were how to work with the small and medium-scale millers to get them also to undertake fortification. And that's where our colleagues at Sokoine worked with them, teaching them about good manufacturing practices to take out the rotten and the broken seeds, to make the vitamin A more stable in the oil that was produced. We also helped them by getting funding for the tanks that are required for fortification and approval from the Tanzania Food and Drug Authority, which controls adding fortificants to food. The picture you can see is behavior change communications at a cultural show to tell people about the benefits of vitamin A. Turned out this wasn't the best way to reach people. The strongest impacts for men were from radio messages, and for women, the cooking shows and the clinic shows were good ways to convince them about vitamin A. Okay, we also documented the process of the project by doing research. We did a baseline survey at the start, which coincided with large-scale fortification becoming mandatory, and after 18 months, we did another survey. So here are the results. So let me explain. Shinyanga province, maybe it's a little poorer, and they choose the cheapest oil, which is palm oil. Whereas in Manyara, they grow sunflowers, and by preference, they consume sunflower oil. So on the left-hand side, you can see the measurements of retinol level in oil at the household level, which we collected. And at the right-hand side, you can see retinol level in blood, which we collected from finger prick samples from the children and the mothers. And it's quite dramatic. So you can see that fortification improved, but much more strongly in the region consuming the palm oil, despite our best efforts with our 3 partner enterprises to sell more sunflower oil that was fortified. And on the right-hand side, you can see the impact on health, that there was a significant improvement in vitamin A status associated with the region that consumed the more highly fortified oil. So what are the conclusions? We concluded, firstly, fortification works. You can see an impact on mothers and children, but you have to reach people who don't consume oil produced by large producers. But it's not easy for small and medium enterprises to undertake fortification. We worked a lot with the 3 in our project to surmount the regulatory hurdles and the logistical hurdles, but more work needs to be done. We estimate that in our project, enough oil was sold, 140,000 liters, such that 500,000 people could try the fortified oil for 1 week. But to reach 1 million people for a year, which is what's required, we need to produce 100 times more fortified oil than we did in our project. So there's something to build on, and j'aimerais bien entendre vos questions.
And I would really like to hear your questions and comments. Thank you very much.
Thank you, Sue, for the interesting presentation. And as you have seen, there is a food production approach, then complemented by value-added food processing, then complemented by the food fortification where the nutritional needs are not met by just the food alone. Now we are fortunate to have 2 external guest experts who would be making comments in terms of connecting this to their experiences. Dr. Lynette Newfield, Director, Knowledge Leadership, Global Alliance for Improved Nutrition, and Colleen Emery, Technical Advisor from the World Vision, but also representing Global Nutrition Cluster. Lynette, please.
Good afternoon, everyone. First, I'd like to thank Annie and the whole team for inviting me to have the opportunity. I'm a Canadian who's been gone for a very long time, so I always like to have opportunities to come back and find out what's going on in work in Canada. I want to highlight, I think, 4 points. First of all, to really applaud the efforts that have been going on in these 3 projects, but in the portfolio more broadly. There's a growing recognition of the importance of working within the food system, working with businesses, and the fact that we cannot address the nutrition challenges that exist in the world unless we do so. So this is a very unique, a very timely, and a very appropriate portfolio of programs, and I'm looking forward to seeing the versions 2 and 3 and so forth that we were hearing a little bit about this morning. The second point I'd like to talk about it a little bit is nutrition. I know there's a lot of people from agriculture. I know there's some from nutrition here. Nutrition is very complex. And I don't say that because I want us to all be afraid of it. I want to say that because we have to embrace that complexity. We have to understand it, we have to work with it, and we have to understand how our efforts can contribute to that complex and broad picture. Within that context, we know that the same populations that are suffering from undernutrition, hidden hunger that was mentioned by one person, stunting that have been mentioned by others, those same populations are now starting to have an exploding problem of overweight and obesity and the associated chronic diseases. And we have to understand how our efforts can reduce, but at the same time prevent that growing problem. So a little bit of a challenge to the team in moving forward, that we look very carefully at the nutrition and understand and measure the nutrition problems in the populations where we work. Who within the household has that challenge? We know that the problems in nutrition vary by age and by gender. We know that the potential for our impact of our interventions varies within the household and the individuals who are consuming food. Unlike interventions where they are targeted and we are seeking, for example, for pregnant women, for young children, food-based interventions go to the household. And what happens after that gets to the household can be very different, and we have to understand and build that in. And I'm glad to see that there was some of that, and I think there's a lot more that we need to be doing to maximize the potential for impact in that sense. We know that more food is not going to solve the malnutrition problems in the world. It's not about more food. We know we need to make sure that there's enough food to feed the people, but it's not just about more food if we're going to solve the nutrition problems that we have in the world. And so we really need to think about that quality of the diet, the quality of the food that we're eating, and that dual message that we have to have in the prevention of malnutrition in all of its forms. In that sense, I'd like to talk just for a moment about Tanzania and the project that you did there with fortification. And this is the third point that I want to make, thinking a little bit more about scale. So first of all, I really like the approach that was taken in that, where we know that industrial fortification is happening. We know that has a great potential to meet the needs and to be impactful, but there's a subset of the population that won't be reached by the existing national strategy. And it was a great effort to bring that together and seek an opportunity to complement that national strategy. And it begs the question of what we mean by scale. We always talk about scaling up programs, but we rarely actually put the denominator on that scale. What do we mean by scale? If there's an existing national strategy that is reaching a fairly large number in the population, we have to understand who we want to reach and how we're going to reach that. And I think this is a very good example of framing a program at an appropriate level of scale and saying there are a proportion of this population that are not being reached with fortified oil. They're at risk of micronutrient malnutrition, of vitamin A malnutrition, and we have the opportunity here to reach them. Similarly, I was very pleased with the case in Tanzania to see that it went through an evaluation and it evaluated impacts in a manner that permits you to measure the true potential for impact. You measured the indicator appropriately, you measured the indicator in the appropriate age group where there is a potential to respond. And that's what I'd like to leave you with, is a little bit of a challenge, again, thinking about moving forward, to build in robust evaluation into the programs that move forward, that build an impact pathway where we have a clear understanding of whose nutrition are we trying to change? What's the nutrition problem we're trying to address? And what is the opportunity of this intervention, of each of the interventions that you're doing, to make that change? And it's always hard to open up the book to evaluate. It's always hard to accept that maybe what we're trying to do here is change what goes into the household, and that's as far as we can get to expect to be able to find a measurable difference with the intervention. But maybe that's okay. And if we understand that pathway and we understand our final goal, ultimately we obviously want to change nutrition, but perhaps with the kind of intervention that we're doing, the measurable change that we can come to may be the food that is purchased by the household, and then there's other actions that have to be complementary to go from there to who consumes that within the household. So that's where I'd like to leave it, and thank you very much.
Thank you, Lynette, for bringing in. Thank you for your comments, bringing in your researcher's hat and also your experience in scaling up innovations in terms of the national reach. And I would like Colin to come in, please.
Hello, everyone, and good afternoon. I'd like to thank the IDRC for the invite to be here today and to speak with you. So I have 4 points that I just want to share with you today, and they sort of follow the where, with what, actually 3 points, and who, but that third point has 2 bits to it, so I guess it counts as 4. So starting off with the where. Where are we working? In my years of working with World Vision International, I started off working in more long-term programs, environments that were calm, that were stable. But in the last 10 years, I have been working in fragile areas of the world, areas that are affected by conflict, areas where famine, drought, earthquake, natural disasters happen with regular occurrence. And I want to challenge us today, if we are going to achieve the SDG targets for nutrition, we need to turn our attention to fragile and conflict-affected states. 45% of the caseload for children that are not growing well, so that are too short for their age, is found in fragile and conflict-affected countries. And increasingly, emergencies are becoming chronic in nature. Think of places like Niger or across the Sahel, South Sudan, Somalia. Emergency actors have focused on trying to reduce death. But what we're seeing is that year over year, wasting levels are remaining pretty much static. And issues of children who are too short for their age in those contexts is increasing. So while we're saving lives, we are not really addressing the underlying causes. So I challenge you as actors in this program to think about, I know you have not been working mostly in fragile and conflict-affected states, but I think there are learnings from this, from your projects, that we need to think moving forward, what can we apply to fragile and conflict-affected areas of the world? Because we need to do this in order to achieve the global goals for nutrition. And secondly, what are we actually bringing to these programs? We know that food security is one pillar. If we are going to improve outcomes for nutrition, it takes an integrated approach. And again, speaking from the emergency context, we've seen year over year that the current status quo for programming for nutrition is not really getting us where we need to be. And what is needed is a more integrated approach. So food security is one pillar in that, but also we have to think of health, we have to think of social protection programs. So how can the interventions that you have invested in, how can they be part of a broader integrated program? So getting on to the who. Something that I thought about as I read through the background information before today is, are we reaching the poorest households? And again, this is important because while we know that poor child growth occurs across the income, or across households' income, we know that the burden is often highest in the poorest households. So are our interventions that we have researched, investigated, are they actually reaching those households or not? The third point, again, links to the who. And this is, are our interventions reaching this critical window? Are we reaching the most vulnerable in groups to improve their outcomes for nutrition? We know that the first 1,000 days of life, so that starts in pregnancy, goes through to the child's age of 2, is a critical window. So we need to think about and emphasize improving women's diets in pregnancy and pre-pregnancy, and looking at child's diets for the first 2 years of life. This is going to prevent children from being underweight, but is also going to address the issues that were raised by my colleague earlier about the growing crisis of children becoming overweight and obesity. So that's basically what I want to say in summary, to think about the where. Where are we targeting our interventions? What are we targeting them with? Is it integrated programming? We know we need that to improve outcomes for nutrition. And who? Are we reaching the poorest households, and are we reaching the groups that need our attention for nutrition the most? Thank you very much.
Thank you, Colleen, for bringing out the important aspects, because the situations related to fragile conflict situations seems to be one of the reasons why the slowing down of undernutrition rates seems to be slower than predicted. So it's an important aspect. I would like to take the opportunity to thank all the project presenters and the external experts for really bringing out the importance of the nutrition aspects within the overall food security agriculture interventions as a nutrition sensitive approaches. Now we would move on to the next session in terms of the discussions with you all. We would like to know your thinking after hearing the project experiences and also expert views. The questions we have similar to in the morning are, what is new and innovative? How will you use what you have learned in your institution and work? Where are the gaps and next steps for the future? So about 20 to 25 minutes discussion, and then we would have 8 to 9 minutes go around to hear from some of the tables which are ready. So thank you, and would like to ask the panelists also to join the tables. Oh, just a minute, so take a picture.